me kind of give you the layout of the agenda today. We're going to start after roll call with the Senate Bill 239. This is a follow-up on last week's meeting, and it will be the presenter has a committee sub we'll take a look at, and then we'll entertain questions from committee members. That was the charge I left you last week, is to be prepared to discuss this. We'll not be taking additional testimony on this bill. That's last week. Then when we get into the balance of the bills, I hope we can move very quickly on these. I will tell the committee members that each bill we're going to be hearing from the House passed unanimously in their chamber, so keep that in mind. Let's try to keep this on track. With that, roll call, please.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg. Senator Carroll. Senator Elkins. Senator Funky Fromeyer. Senator Nemes.
Present.
Senator Tishner. Senator Wise. Present. Vice Chair Douglas. Present. Chairman Meredith.
Present. Again, we do have a quorum constituted to do business. First bill is Senate Bill 239. Senator Douglas, if you would, please come to the table, identify yourself for the record, and proceed. As I mentioned, this is going to be to entertain questions from the committee members, but you do have a committee sub. I think you probably want to give a brief explanation of what that sub is, and then we'll move into the questions.
Thank you, Mr. Chairman, and thank you, members of the committee. I am Senator Don Douglas, District 22 State Senator. The committee sub really has to do with my sort of listening to some of the things that were brought to my attention after the initial presentation. We took a look at the bill itself, and the question was whether or not we needed to tighten up a few things, and some of it was just simply the language. In the previous bill, we took a look at healthcare services, and we felt that might be better served by saying medical services to make sure that we were consistent throughout the bill. I wanted this bill to be consistent in what we covered and what we were trying to do. We also took a look at, if you would, another section that had to do with covering the payers. This is a physician recruitment and retention bill. That's what it is.
Sorry. Since we've adopted sub, let me open up for questions from committee members regarding 230 Bill 239 as amended by Committee Sub 1. Are there any questions?
Were you recognizing me, Mr. Chair?
Yes, I am.
Okay. Thank you, sir. I'm looking at the sub, and I'm very concerned about the breadth of this bill and the definition of sort of conscious and including any sort of ethical belief that someone has. And I think we might disagree on the likelihood of some of these things happening, but could you tell me, just based on the language of the bill, would it be possible for a healthcare physician to say, I'm not going to treat a veteran because I have a moral objection to the war they served in? Or for a nurse to say, I'm not providing prenatal care to someone who conceived through IVF because I have some sort of conscious objection to that. Would those be allowed under the language of this bill?
With all due respect, Senator Chambers Armstrong, this bill, and one of the things I've stated about this bill is that this bill is not a fix, but it is a step. We have a healthcare crisis in this Commonwealth. I myself, as I mentioned, I have 3 kids. They are all 3 physicians. They are choosing not to practice in the Commonwealth of Kentucky. Now, there are different reasons why, but this is one of the reasons. So I don't expect this bill to be perfect, and I don't know that anyone who comes in front of any committees is going to tell you that they have a perfect bill. So we can find exceptions in any space because we just simply can't cover them all. The truth is, in actuality, the truth is in the healthcare space, there are physicians who already make those kinds of decisions. But they're not protected when they do it. And then they get threatened with their jobs. They get threatened with their livelihood. They're the ones who've paid the money to get these specialties. And then they're somehow told that you don't have control over what it is that you want to do with your life in the healthcare space. We don't tell that to any other group. Any other group. So why do we take the people who are in the top 0.5% of the educated people in the world, and we tell them, you don't know enough, you're dishonest, you're not going to do what we want you to do, and because you want to do something that you might want to do, and you're in the top 0.5% of the educated people in the world, you're not smart enough to make that decision that I can make for you. This bill will allow them to say, can you please allow me to use my conscience as I trust you to use yours? That's all this bill does. That's all this bill does.
May I have a brief follow-up, Mr. Chair?
Brief, very brief.
Thank you for the answer. And it sounds like you're saying that the language does allow those sorts of objections that I just raised.
No,
And so,
I'm not.
okay.
I'm saying this language allows physicians to be treated like everyone else is treated. Now, we can read into that whatever we want. Whatever we want. I have people in the back of this room who could read other things into that. That's okay. This is America. We are allowed to think and believe what we wish.
So I suppose my question is, can you show me where in the bill there is a guarantee that by anyone in the healthcare space, because this is very broad, it's not just doctors, it's payers, it's anyone that works in these facilities, where in the bill does it guarantee that patients aren't going to be harmed as a result of someone exercising their conscience?
First of all, I'd like to correct one thing. The substitute takes out the payers. So the payers are not included. There are no guarantees in life. Anyone in the healthcare space will tell you when you get out of bed in the morning, if you have a cat, there is no guarantee that you will not trip over that cat and break your hip. There are no guarantees. We don't put guarantees on people in our society. Why do we ask our physicians? Why do we ask our healthcare workers to guarantee things? I don't understand that.
We do have another question. Senator Adams, if you would. I appreciate the motion and the second.
Thank you, Mr. Chairman. And this is a quick question. You know, every day I read through my green slips from emails I get from constituents. And to be honest, I haven't heard pro or con really about this bill. Either way, what I do want to ask you is the KMA and the Kentucky Nurses Association, are any of those groups on board with this bill?
I've heard nothing from the KNA. The KMA, I met with them last Friday, and we discussed this bill as well as some other bills.
Okay.
They said their priorities were with some of the other bills, and that they could live with this.
Okay. Thank you.
Senator Carroll.
Thank you, Mr. Chairman. Senator Douglas, are there any provisions in this bill that addresses emergency situations where that might some type of objection might come into play and during an emergency situation where there might not be another physician, surgeon, whatever the case might be, available within a timely manner related to an emergency situation?
There is. Give me just a second, Senator Carroll.
I might be able to help you, Senator. I think it's on the first page. We talk about the Emergency Medical Active Labor and Treatment Act that covers those emergency situations.
Correct. That begins at line 24.
Very good. Thank you.
Senator Berg.
Good morning, sir. Thank you very much, and thank you, Mr. Chairman. Can you go over what the current standard of practice is when a physician does not, or a healthcare provider, but a physician does not want to treat a patient? What are you supposed to do without this law?
There really isn't a current standard.
Excuse me, sir. There are current standards of healthcare, of medical ethics. Physicians are allowed to refuse to treat a patient if that patient is aggressive and it's not a medical emergency and it's not a mental health problem. They are allowed to refuse to treat a patient if it is outside of their scope of care. And they are allowed to refuse to treat a patient if they think the treatment will do more harm than good. That is current medical ethics clearly laid out. What does this do to change that?
Senator Berg, I'm not sure what practice situations that you've been exposed to. In private practice, in the real world, it doesn't work that way. I've been in practice for almost 40 years. I've been in the healthcare space for 40 years. I've seen a number of my colleagues who, even though the practice standards you cite might be something that is written, it is not something that is followed. And those physicians really don't have much recourse when that happens. There are different practice situations, as you are aware. There are academic situations, there are private practice situations. And within those, I've had a number of my colleagues over the years talk to me about being threatened with their position within the practice, or being threatened with their job or their stability in that practice by not doing what they were being asked to do. This law is meant to give them some recourse that they can actually depend on.
Senator Douglas, thank you for your answer. We do have a motion second on the bill. Becky, if you would, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong.
May I explain my no vote briefly, Mr. Chair?
Yes, please.
I think that this is a dangerous bill. I think that it is very broad, and although I appreciate the provisions about still providing emergency medical care, as we know, non-emergency medical care is also very important, and I don't see any protections to make sure that patients still get the care they need, and so I'm voting no. Thank you.
Senator Berg.
Explain my no vote.
Briefly, yes.
I vote no, sir, and I really hate to disagree with a fellow colleague, but first of all, I have practiced in both academic and private practice and the veterans system. I have never once been faced with a conundrum where any of my physicians, and I have been chief of staff, I have been director of radiology, I have supervised physicians my entire life. I've never, ever had a physician come up to me and say, I can't do this, and they're making me do it. It has never happened in this state that I'm aware of. I would like honest, real examples from this state that we are addressing. I agree with my colleague. I think this bill is dangerous in its breadth, and it will leave patients in situations where there may not be a healthcare provider to respond. I feel extraordinarily obligated as a healthcare provider to respond. We are required to respond if we have the knowledge and the ability to save somebody. So I vote no. Thank you.
Senator Carroll.
Aye.
Senator Douglas. Aye. Senator Elkins.
Aye.
Senator Funky Fromeyer. Aye. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Aye. Chairman Meredith.
Aye. Vote is 9-2. Bill passes with favorable expression. Thank you, Senator Douglas, for presenting your bill.
Thank you, Mr. Chair, and thank you, members of the committee.
Moving on to the agenda, the next is House Bill 31. And I would encourage you to run to the table because we are trying to keep this train on the tracks.
Don't pass me over, Chairman.
It's good to see you this morning. As I noted earlier, this bill passed 93-0 out of the House chamber. So great. Please identify yourself for record and proceed.
Thank you. My name is Deanna Fraser Gordon, State Representative, District 81 in Madison County. This bill would simply align Medicaid to cover at-home testing for patients who are on blood thinners. Currently, patients who are on blood thinners like Coumadin have to get in-person labs drawn every week.
Motion second on the bill. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Explain my I vote.
Yes, please.
Thank you. Thank you and thank you, because this is actually a real problem for real patients. I ended up putting my mother in a nursing home because we anticoagulated her and there was no way to get her tested at home safely enough to keep her there. Thank you, and thank you.
Thank you.
Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins. Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Aye. Bill passes unanimously.
Motion for consent?
There's a motion for consent and a second. Those in favor of consent say aye.
Aye.
Any opposition?
Thank you, Chairman and members.
Congratulations. Don't you love the Senate? Yeah. We do too. Next bill is House Bill 57. Representative Chris Freeland. Good to see you this morning, gentlemen. If you would, let's keep the momentum and please identify yourself for the record. Feel free to proceed.
Thank you, Mr. Chairman, ladies and gentlemen. Mr. Eddie Sloan is with me this morning. He's the Executive Director for the Kentucky Board of Emergency Medical Services. And in front of you is House Bill 57. And this is a bill that has been worked on for a couple of years. It was part of the EMS task force a few years back and makes 3 changes to our KRS. And if it's okay, I'll have Mr. Sloan explain it and highlight some of the changes.
Well, certainly, Mr. Sloan is going to see you again. We just saw each other yesterday evening. But,
Yes,
in
sir.
essence, this bill is a reorg bill and also includes a provision for reciprocity from ENT of the state. So that's the essence of the bill. Oh, there's a motion and a second. Not that we don't want to hear you, Mr. Sloan, but we keep this thing moving. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Aye.
Senator Carroll.
Aye.
Senator Douglas.
Aye, and explain my vote, please.
Yes, please.
I want to thank you for bringing this bill. This is an important bill. I know a lot of people don't think about that. In the healthcare space, it really is an important bill, and I want to thank you both for the work that you've done and the diligence that you've put in. Thank you very much.
Senator Elkins. Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Senator Meredith, or Chairman Meredith.
You confused me there for a moment. Didn't know who it was. Bill is unanimous. The vote passes with favor expression.
Motion for consent?
And there's a motion for consent. Is there a second and a second? All those in favor of consent vote aye.
Aye.
Any opposition? All right.
Thank
Bill
you so
passes.
much.
Thank you. Appreciate you being here this morning. Next on our agenda is House Bill 274, and my young great friend Representative Danny Bentley is already moving to the table. Glad to have you here this morning, Representative.
Thank you, Chairman. My name is Danny R. Bentley, District 98 of the Great Commonwealth of Kentucky. And with me is Brooke Huspis, President of the Kentucky Pharmacists Association. Kentucky is facing a public health crisis, as mentioned before in this committee, in our childhood vaccines. According to the CDC, Kentucky rates of vaccination against diseases like measles, mumps, rubella, tetanus, diphtheria, pertussis, polio, and the varicella all rank lower than 5 of our 7 surrounding states.
There's a motion on the bill. Is there a second? Second. A motion and a second. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
explain my yes vote, please?
Yes, please.
I just want to reiterate to anybody and everybody who is watching how essential routine childhood vaccinations are for the health and welfare of our Commonwealth. Anybody who tells you otherwise is misinformed. The literature is unequivocal. The data is there, and we are putting our children at risk by not adequately vaccinating them. Thank you.
Senator Carroll.
Aye.
Senator Douglas.
Aye, but explain my vote.
Yes, please.
Representative Bentley, this is a good bill. Initially, when I looked at it, I was a little skeptical. But the more I read and the more I came to understand the bill, this is really a good bill, and I think it will very, very positively affect a lot of people in our healthcare system. So I want to thank you both for bringing this bill. Thank you, Mr. Chair.
Thank you.
Senator Elkins.
Aye.
Senator Funky Fromeyer. No. Senator Nemes.
Aye.
Senator Tishner. No. Senator Wise. Aye. Chairman Meredith.
I vote aye, and I believe the vote is 9-2, so the bill does pass with favorable expression. And Representative Bentley, thank you for being here today. I just want to emphasize again the importance that our independent pharmacists play in the healthcare arena. I think that's overlooked many, many times. That too much focus on the Walgreens and CVS, but particularly in our neighborhoods, you place an invaluable service to our constituents, and we greatly appreciate that.
Chairman, this morning on the radio, there's 45 cases of measles in 17 states right now. And that MMR is very important. So I agree with Senator Berg, and thank you for having us, Mr. Chairman.
Good to have you here. Thank you. So we'll move on to House Bill 386, which is Representative Robert Duvall. Dr. Duvall.
Good morning. Robert Duvall, Representative District 17, Warren County. Chairman Meredith, Vice Chairman Douglas, members of the committee, thank you for the opportunity to speak with you this morning. I'm going to talk with you about House Bill 386, which updates pseudoephedrine Sudafed legislation passed several years ago. First of all, this bill protects the original intent of the previous legislation. Kentucky has one of the strictest Sudafed access laws in the country and will continue to do so. In House Bill 386, Kentucky will continue to be 20% more restrictive than the federal government's monthly limits. This monthly limit will not change. However, the current 24-gram annual limit is 78% less than what a typical American can purchase annually. House Bill 386 seeks to bring Kentucky's Sudafed access laws closer in line with the rest of the country by eliminating the annual limit of 24 grams and eliminating the package per transaction limit. The new annual limit would now be 86.4 grams, which once again is still 20% less than the federal limit, so more restrictive than the federal limits. So why is this change needed? Under current law, an individual has access to just over 3 months of the over-the-counter medicine per year. This means that individuals with chronic sinus, congestion, and allergies would have to ask their spouse or family members to purchase more Sudafed for them after only 3 months. For reference, the 7.2 gram per month maximum allows these allergy sufferers to take one pill every 24 hours to provide relief. For some individuals, it is the only product that allows for a full night's sleep. So Sudafed and phenylephrine are the only two oral decongestants available over the counter. And the Food and Drug Administration is currently reviewing the effectiveness of oral phenylephrine. If the FDA determines that oral phenylephrine is ineffective, that would leave only one oral decongestant available, which is Sudafed. And there is evidence to showing that probably will happen, that phenylephrine will be pulled. So increased accessibility would be crucial. So for reference, there is no change to the requirements to show your driver's license, and your purchase amount will continue to be tracked. This is a pro-consumer, reasonable accommodation for Kentucky families seeking to find relief from congestion associated with a common
Representative,
cold.
we have a motion on the bill. Second. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Byrd. Senator Carroll.
Aye.
Senator Douglas.
I would explain my vote.
Yes, please.
Mr. Chair, I apologize for having to explain so much this morning. I normally don't do that, but Representative Duval, much of some of the things that we're talking about and how we got to where we are has to do with the substance use disorder space. And having practiced non-opiate pain management for about 26, 27 years, I get this. But at some point, we had to become more fair to those who are not participating in that space. So I really want to thank you for this bill. I don't think that many people really understand what this bill will do for our public in terms of their access to products that will relieve symptoms that are really causing them a lot of bodily harm. So thank you very much. Thank you.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes.
Aye.
Senator Tishner. Senator Wise. Chairman Meredith.
Excuse me. Aye. Bill passes with favorable expression. Congratulations. It was unanimous. Is there a motion to consent?
Second.
Motion and a second for consent. All those in favor say aye.
Aye.
Any opposition? There being none, congratulations. Bill moves forward.
Thank you very much.
Thank you. Appreciate you being here this morning. Our next bill is House Bill 462. Representative Steve Bratcher. I think you can walk a little slower now. We've made great progress this morning, so just take a deep breath and just
Okay.
let's all relax a little bit. And just,
Representative Steve Bratcher, 25th District, Elizabethtown.
Gene Deathridge, President of the Kentucky Recovery Housing Network's Advisory Board.
bill passed 96-0 out of the House. So
Correct.
Please proceed.
Okay.
Tell us what it's about.
So this is basically a cleanup bill that has to do with recovery residences in our neighborhoods and our cities, and it basically defines more of what a recovery house is, the types of practices they can do, as well as allows the Health and Human Service to be able to put more regulations on them as they see fit. So would you?
There's a motion on the bill. Is there a second? Motion and a second. Please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Byrd. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Elkins.
Aye.
Senator Funky Fromeyer. Senator Nemes. Senator Tishner. Senator Wise. Chairman Meredith.
Aye. The vote is unanimous. Pass with favorable expression. Is there a motion for consent? Motion and second for consent. All those in favor say aye.
Aye.
Any opposition? There being none, congratulations, Representative Bratcher, and move forward. Thank you. Our last bill is House Bill 477, last but certainly not least. Good morning, Representative Neighbors. Appreciate you
morning.
being here. Good to see you again.
Yes,
Please
sir.
identify yourself for the record, as well as your guest, and proceed.
Thank you, Chair Meredith. My name is Amy Neighbors, and I represent the 21st House District. Today, I bring to the committee House Bill 477, which is a bill that will encourage the early identification and treatment of sepsis, and to agree with the U.S. Centers for Medicare and Medicaid's coding classification system. My family has been affected by the damage that sepsis can do, from the elderly to the young. Early treatment truly is the key to successful recovery. At this time, I would like to allow my guests to introduce themselves and take a moment to further explain the importance of this bill.
Thank you. Thank you. I'm Deborah Campbell. I'm Vice President of Clinical Strategy at the Kentucky Hospital Association, and I've been a nurse for about 40 years. I want to thank Chairman Meredith and the committee for letting me come today to talk about the urgency that clinicians feel around this issue, because we know, and it's well understood, that for every hour of delay in recognition and effective treatment of sepsis, the chances of death increase by 7%. And sepsis is not a disease, but rather the body's reaction to infection. And it can be any kind of infection, urinary tract infection, pneumonia, wound infection. And that we don't know why some people develop sepsis and others do not. And so the unpredictability of that causes the timely screening, early detection, and rapid initiation of effective treatment to be crucial, because even the same organism can cause different effects in different people. So early screening and timely treatment can halt that progression. And anyone who's been to the ED knows that despite a well-run ED, the time spent in the waiting room can be lengthy at times and often exceeds an hour. And remember that golden hour. So sepsis has a high mortality rate, but sepsis caught and treated at that point has a mortality rate of about 4.4%. But severe sepsis and septic shock have mortality rates of 28 to 68%, and that's 1 in 4 to almost 3 in 4 people who will die. In addition to death, people suffer amputations, cognitive defects that require them to remain out of work, psychological problems including severe anxiety and depression. Many are never the same. So how do we stop this runaway train? Well, we have to get that screening done early and then adhere to the CMS Sepsis 1-2 bundle that requires that we look at certain signs that are available to us at the time that patients enter the ED. And that's an increased temperature, an increased heart rate, an increased respiratory rate. The proposal to possibly change to using a different assessment score, which is called SOFA. SOFA stands for Sequential Organ Failure Assessment. So in the name, it tells you that we are going to be waiting to look at signs of organ failure. That runaway train is now run away, and it's much more difficult to prevent all of those negative outcomes that I just discussed. So even the folks who created the SOFA assessment have said repeatedly it is not to be used as a screening diagnostic tool. It's not what it was created for, and we mustn't use it that way. Patients will be harmed. And in fact, the Kentucky Statewide Sepsis Consortium, which was begun in 2021, and all hospitals with EDs participate in that in the whole Commonwealth. Using the SEP1 bundle, Kentucky hospitals have decreased in-hospital deaths from severe sepsis and septic shock by an average of 37 deaths per 1,000 discharges per month. So we know it works. Thank you.
Thank you for your testimony and presentation. We do have a motion and second on the bill. Before we take that vote, I want to acknowledge Senator Tishner. She has a similar bill she's filed on the Senate side, so we try to have all the bases covered, but appreciate you doing that. Becky, if you would, please call the roll.
Senator Rocky Adams. Senator Chambers Armstrong. Senator Berg.
Explain my I vote.
Yes, please.
I just want to say thank you. Thank you, because time is of the essence in these situations. And you've seen, I don't know about you, sir, but I've seen what sepsis can do to an actually healthy body very quickly. And so for us to wait, for physicians to wait when they suspect this is a mistake. So thank you, and thank you.
Thank you. Senator Carroll. Aye. Senator Douglas.
Aye.
Senator Elkins.
Explain my vote, please.
Yes, please.
I vote aye. In 2015, I suffered Guillain-Barré and sepsis, and I was sent home by my doctor. I was sent home from the ER, and only because my wife took me to another ER and was diagnosed with sepsis many hours after it began, I'm sitting here today. I thank you for the bill. It's an important bill. It will save lives. I vote aye.
Senator Funky Fromeyer. Aye. Senator Nemes.
Aye.
Senator Tishner.
I'd like to explain my vote.
Yes, please.
My I vote. Thank you so much for bringing this bill forward. We had a fun experience this year with my father for sepsis diagnoses, and we got so good at it, we were telling the nurses and the doctors when it was coming in order for them to treat him quicker. So this is so important, and it will save lives. We've been through the experience. We've gone down the path of septic shock twice. It's very hard, and a failed kidney now. So it does change lives, and this, thank you. I'm sorry for getting emotional. Thank you.
Senator Wise. Chairman Meredith.
Aye. The vote is unanimous. Bill passes with favorable expression. Is there a motion for consent? Motion second for consent. All those in favor vote aye. Aye. Any opposition, will like sign. Congratulations.
Thank you. Thank you very much.
Move forward. We have, does anyone have any votes they need to register? I know some folks came in late, but seeing none, let me remind the committee members, I know everybody's anxious to move on because we got a lot to do today. We will have a special called meeting in this committee to deal with Senate Bill 280 and 281. I don't know when that will be, but just be prepared that we will have a special called meeting. And Senator Elkins, you had one or two votes? 2 aye votes on which bills? 31 and 57, duly noted. With that, there's no other business come before this committee. We stand adjourned. Thank you.
So just make sure that he gets any of those with the big X. Just the little X's. Yeah.
Gotcha.
And there's, I tried to mark out where they
Did you? I thought we might, but not 20 minutes ahead of schedule.
Yeah.
This means next week we can do 12 bills. You gonna do more unanimous House bills?
Hey, Mallory, make sure you hold on to your papers and stuff for you. Okay.
Consensus on this one so that we could offer the ability to recognize that one before. Damon kind of expressed to me the other day on another one that is so broadly affecting so many people by example, creating personal story.
We'll work with leadership in the rules committee and they'll pull it off of
who are not in there and they don't understand. But there's things
I think it has
even though they don't have
statewide value.
They may not have as much data as those people.